Uh, it is my privilege to have Cynthia Schindler as my guest in this episode on the state of long-term care in Canada and the challenges Canadians are facing in their quality of life and or care when facing the possibility of going to a long-term care facility or LTC facility. So I'll be using LTC as a term of reference when I must mention long-term care. So Cynthia's professional background includes 10 years of practice as a behavioral geriatric specialist in long-term care facilities. During this time, she was chosen to be a part of an elite federal government team whose mandate was to develop practices to improve the quality of life for those requiring assistance. She quickly realized that the correlation between advocacy and financial resources was directly related to the quality of care one receives. For the past 20 years, she has successfully guided and educated people and brokers like me on the benefits of specialty insurance products. Having experienced LTC issues with both with my clients and family, I genuinely believe that this has largely been ignored by many Canadians. With that in mind, a discussion on this topic really matters to me and my audience. Uh, so, welcome, Cynthia, and thank you for taking this time to talk to me about long-term care. I cannot think of a better person who's more qualified to talk about long-term care than you. And so you can start by sharing your knowledge and experience about the situation in the publicly funded LTC facilities in Ontario and where we are headed.
Okay, thank you so much, Shiv. I certainly have been talking about this topic for about 40 years now, and am very happy to share my knowledge because when a person's circumstance in life changes, whereby they need the assistance of another person, it's really important that that person have a strategy in place before something happens because it doesn't just affect that individual, it affects everyone around them, their loved ones, their family member, their friends. So I can't stress the importance of enough of brokers like yourself, Shib, having this kind of a conversation, opening dialogue with people about what their plan is for their future healthcare strategy. There are a number of different options that are available to people, but sometimes I think we get caught up in our busy lives and we don't stop and think about this topic. I mean, for one thing, it's not a very sexy topic to think
Absolutely.
about, but but the reality is, you know, the statistic is actually 74% of Canadians over the age of 65 today are already requiring some kind of extended care. Now, that might be in a short-term situation, it could be in a long-term situation, but the point of the matter is that people have to have a strategy because unfortunately our system is broken. And, you know, we are currently living in an era where we've lived longer than we've ever anticipated before. You know, previous decades, people passed away early, and this kind of planning wasn't so much of an issue. Today, because people are living longer, unfortunately, not necessarily healthier or wealthier, they do have to have a plan for when the time comes that things change for them, either from a physical or a cognitive perspective. So people might want to consider what the different options are. A lot of people feel that, you know, the government will provide for them because we've sort of been trained as Canadians to think that the government will be there for us from womb to tomb. That's, you know, I think something that we've all sort of prided ourselves as being Canadians is having that kind of a privilege in our society. But the reality is the government cannot provide 24-hour care if it's necessary. In fact, the amount of care that's provided is very minimal, and it's not really something that we can count on or rely on, because it very much depends upon, from month to month, what's in the budget. It depends upon who in your community might have a more serious problem than you. So if you are relying on government benefits, there's a good chance that they may not be there. They're certainly not guaranteed. And they only provide for custodial type things, like, for example, helping people to get up in the morning, get dressed, and get ready for the day. But there's really no control over it. I mean, you have no control over who's going to come into your home, or what they're going to do, or when they're going to arrive. So
Yeah.
if you're accustomed to being an early riser and the person shows up in the afternoon, that will very seriously impact your quality of life. And we have to think about all the other things that need to be done, like who's going to manage the household, the cleaning, the purchasing of groceries, the preparation of meals, the yard work, the paying of bills. All of these things have to be taken into consideration. A lot of people think, well, I'll rely on my family and friends. Well, that's really shifting the responsibility to others who, aren't trained to be caregivers, right? They would, I think, wholeheartedly much rather be a care manager, meaning that the person who needs assistance actually has thought this through and has a plan in place. Because
Yes.
family members and friends, they're not trained to be caregivers. I mean, Shiv, would your wife know how to get you out of the bathtub if you needed assistance?
Yeah. I wouldn't know. I mean, it's just it, I had a conversation yesterday with somebody, and I know both the husband and wife are really taking care of uh, the parent-in-law, the father-in-law, and it's very, very hard. I mean, they have the resources themselves, so they don't really need to go to work. But it is so hard, and they've been doing that for the last 2 years now, and it's only getting worse, not better. And combine that with the situation that we have right now, the pandemic situation. This conversation couldn't have been more timely because there are so many issues also associated with COVID-19 and the pandemic and the long-term care facility. So, we hear the government talking all about, what they want to do with LTC and more funding and all that. Yet, I think they're very slow in sort of making that progress right now. And, so I think we cannot just simply rely on the government, you know, to look after us. And you said that very right. I mean, you can't do that.
Well, even before the pandemic, it was October 2019 in the Mop and Pail, Globe
Yeah,
and Mail, Canada's
yeah,
newspaper. There was a very startling article that certainly caught my attention and my eye. And it referred to the fact that publicly funded long-term care is going to triple in cost in the next 30
wow,
years. Okay.
wow,
From $22 billion to over $70 billion. Okay.
wow.
They don't have a plan now. Okay. They're still dealing with the economic fallout of COVID. So what's going to happen if they don't have a plan now or a strategy for this very thing that's coming upon us, almost like a tsunami, if you will, because we are, as maturing people, there are more of us than there are younger people to help carry the load. So what's going to happen is the burden of this is going to fall on families in 3 out of 4 cases if there isn't a plan. And it doesn't need to be that way, because as advisors, we need to educate those that we serve about what their options are, because there are options. There are options that are affordable, logical, and bring peace of mind, not just to the person in need of care, but to the family, because the family shouldn't be burdened with the care of someone that, number one, they don't know how to care for that person, but also they may not be close by. They have many other responsibilities like their own families and children
Yeah.
to care for. So, this thing is real. This thing is real. It's a new issue that we have to tackle as a society. And I am so proud of you, Shiv, that you are concerned and you want to advise those that you work with what their options are and what they can do to prepare for this, because it affects us all.
Yeah. And you know what? Interestingly, the conversation that I had yesterday with this person whose effect was looking after the father-in-law, um, she said that they need male, first of all, male caregiver, and it took them some time to get three of them coming in on 3 different days in the week. The rest of the time, then they have to look after. And right now, um, with the Alzheimer's sort of still, in full swing right now, it takes them almost 2 hours to feed and give them breakfast. By the time they're done, they're into lunchtime again, and then from lunchtime to dinner time again. It's like they're tied down completely. And so combine that with, they need somebody like a male. They didn't want a female for that, for their own reason, for the father-in-law, or whatever. It was kind of challenging for them. So they've been going through for the last 2 years. And when I had the discussion with them yesterday, I said, you know what, we need to prepare. We cannot rely on our children to look after us. We have to do something about it. And so, it was a good conversation I had, but I think it's something that's common with so many people. And
Oh,
we tend
definitely.
to ignore it, right?
Yeah,
Because
yeah.
we're not.
I think people are starting to ignore it less because I think, number one, the pandemic has taught us very well the importance of having a plan, especially a plan that allows people to stay in the comfort and safety and familiarity of their own home. And thankfully, as a broker, you're very aware that there are very affordable, easy to acquire plans to help families cope with this time. So, that they're not alone, that they have resources, that they have something to lean on during this very trying time, because the emotional toll that someone experiences when they are caring for a loved one that's in need, that is dependent, is incredible. It really affects relationships, not just with the person that needs care, but the other relationships that you're being taken away from to care for someone that needs care. It's extremely stressful. People wind up feeling angry, and very depressed. And it doesn't
Yeah.
need to be that way if
No.
there's a plan. So good on you for talking to those people that you care for about
Thank,
this issue.
thank you. So quickly, in under a minute, can we just talk about the cost that one has to pay or not have to pay if in a publicly funded program or LTC facility versus better quality of care, and then they need to go into sort of a semi-private LTC facility. What costs are we looking at in the first instance where they're not paying anything? Second instance, sort of reasonably good semi-private, and obviously what the cost would be for a private LTC
Okay.
facility.
Yeah, there's quite a range. I mean, for those services that one may be fortunate enough to receive in their own home, perhaps like in the early stages, and a person will be in their own home for an extended period of time, even if they need a long-term care bed, because the waiting list is in the thousands. So,
Right.
so you have to have some level of preparation, and taking a loved one to a hospital for relief, okay, because the family just can't handle it anymore, is really not a good option, because many families have been surprised at the fact that they get a bill at the end of their loved one's hospital stay, because hospitals are acute care settings. They are not
Yeah.
long-term care facilities where they are looking after people with long-term care needs. Okay, so again, this is something that has to be thought out. If
Yeah.
one is fortunate enough to, or unfortunate enough to be forced to take a bed in a publicly funded facility, you're looking at a minimum of about $2,500 a month, and that's just room and board. Never mind, expenses associated with having assistance to go to appointments, getting one's hair done, entertainment. There's all of these things that people don't think about. So publicly funded care is going to be a minimum currently of $2,500 a month. And there's no guarantee that you're going to get a home near your home. Okay, there's no guarantee that if you don't take what you're being offered, that you're going to get what you want.
Yeah.
And the more times you say no to the system, you go to the back of the line. Okay.
Right.
So, that's something that people need to be aware of, because you certainly don't want to go through that. Now, when you go to a private kind of facility, the range in cost is very much dependent upon supply and demand. It can be anywhere from $5,000 to $10,000 a month, depending on the type of facility, a loved one would want to be in. So,
Yeah.
these are things that definitely have to be thought about, because if you have a plan, you are much more likely to conserve and preserve your own assets without having to perhaps encroach upon them in a down market, which is just that much more difficult to crawl out of. So having a plan provides a financial cushion, as well as peace of mind, because there's some sort of strategy in place. So every Canadian at some point has to take this step to put this kind of a plan in place for themselves.
Absolutely. And even if you're on the list for a publicly funded LTC facility, it's not necessary that you would get that spot close to where you live or in the city where you live. You could be They could be offering you a bed if you're living in Toronto, in Kitchener maybe, right? Because that's where the
Exactly.
bed's available. And
Exactly.
so think about all the other costs associated with it, and the problems that occur with that as well. So I think it's something really one has to think about and prepare. And the statistics are there that one of the, I don't know what percentage that is, but we're going to need that facility minimum of at least 2 years, right?
Exactly. And
So
in my practice, I saw people, there's a, and that's just a statistic. That's just an average. Many
yeah,
people, could be placed in a facility for much longer a period
yeah,
of time. So, again, you people want to have a plan so that they, can maintain what they have, because I think most people want to pass on what they've strived so hard to create. They want to pass it on to the next generation to give them a fighting chance,
yeah,
right? So
absolutely,
the only way that you can efficiently and intelligently do that is to have a plan in place for this time.
absolutely.
It's
So Cynthia, let's quickly talk about the solution. You have a plan. You can buy a privately owned insurance product. What would be the criteria to qualify and start receiving those payments?
okay. In in the past, traditional long-term care insurance was an option for people. It's no longer an option going forward, because it's gone the way of the dodo bird. For one thing, the insurance companies lacked the knowledge of how to underwrite such a product, and the uptake was not very good. It was out of reach in terms of cost for most Canadians, and basically even the most minor of health problems put up a red flag for the underwriters at the insurance companies. So many of the Canadian carriers have chosen not to offer this product. On the My Dignity platform, there is what we call a home care assistance plan that basically provides a pot of money that's going to pay people for the different benefits that they might need. And of course, the most important benefit is being able to hire somebody that you like, that's qualified to come into your home and provide the care that you need when you need it.
Right.
So these kinds of plans are very easy to acquire. There's no medical. It's just as long as people can respond favorably and genuinely favorably to the health questionnaire, it's an automatic approval. I mean, the plans even accept people who have type 2 diabetes, people who aren't insulin dependent diabetics. You can have had cancer as long as you're in remission. You know, basically 95% of Canadians can qualify for these very affordable and tax advantaged plans because you actually get a tax receipt for the premium, because CRA sees it as what they call a private health services plan. It's an insurance-backed plan to help people provide for their future health care needs. And it's one of the few products that are like having your cake and eating it too, because while you get a tax receipt for the premium, the benefit is tax-free to the recipient.
Right.
So it's a
That's
really
amazing.
intelligent plan, and it's really one of the only insurance strategies left available to our society.
Absolutely. You know what? Every time I have a conversation with you, Cynthia, I always learn something new. And all this conversation that we had today, I think was so meaningful. And I'm hoping that the message will go out there to people and start thinking about what they want, done for themselves. Or do they want their children to be looked after? Or do you want their children to be looking after them, or they just want to take the bull by the horn and do it themselves and provide the peace of mind to the children as well, because they do want to help, but they're not equipped. They're not professionals, right? So you want
Exactly.
to provide
And
them the resources, financial
yeah,
resources.
they can certainly help, and I think they'd be much more appreciative of being a manager of their parents or their loved ones' care as opposed to being the caregiver, because they honestly do not know how to do those kinds of things. And also, the person in need of care, we have to be concerned about their dignity. You know,
Absolutely.
a mother may not want her son to see her in a compromised position like that. And these are things we have to think about. I know it's hard to think about them, but denial's not a solution to this, right? We have to take
Absolutely.
the bull by the horns, and you need to walk through the door when the door is open, right? After
Absolutely.
something
Absolutely.
happens, it's too late. Okay, so a plan
Absolutely.
has to be in place before things
Absolutely.
change.
You know what? This has been so good. Thank you so much, Cynthia. I
You're
really
welcome.
appreciate that, and I look forward to having more conversations with you. And as always, I'm always reaching out to you, and when I have questions or my clients have questions, and you're such a good resource for me and support. So I thank you from the bottom of my heart, and I look forward to seeing you again at some point in a different episode.
Okay, my pleasure. Everybody, stay positive, test negative. Be well.
Thank you.
Bye
Bye.
bye. Bye bye.